Another one coming in for you, Doc. Will frontline healthcare workers be tested for antibody immunity in Northern California? Where is that now?
Well, we know that there's development of antibody testing, and that's going to be an important piece to how we recover from this whole pandemic. Because if we can determine that large segments of the population have immunity, have antibodies, and are likely to be protected from COVID-19, that can be very helpful to know that we're at a point where we can start to resume some of our normal activities, and people can go back to work, et cetera. So I think there's more to understand about that, though. Because this is a new infection, we don't know how that immunity is going to work. Normally, in most infections, somebody develops an illness and they develop antibodies, they develop essentially protection that can last some period of time for that infection. But we don't know how long that protection may last for COVID-19. Are we talking about months? Are we talking about years? So I think we need to figure that out. And then the testing itself, to test for antibody presence against COVID-19, we don't know how effective those tests are at this point, how sensitive they are, what their false negative rate or false positive rate may be. So there's a lot more to learn about the antibody testing at this point. But I think it's going to be crucial at some point to know whether people are immune to the illness.
Next text coming in for Dr. Evans. I have Lyme disease making me vulnerable to infections. Does that put me at risk for COVID-19?
So it's hard to know the answer to that specifically without knowing more medical history there. But I would say that if a person has a susceptibility to infection in general, for whatever the reason may be, then that person may be more likely to get the infection and may be more likely to have more of a severe response to the infection. So that would be a person who would be at higher risk. I don't think there's any data specifically looking at Lyme disease and susceptibility to COVID-19, but there may be more data as this thing becomes more clear.
Next one coming in, is it okay for football and baseball leagues to start practicing again, maybe at a park or a school, if they're following that 6-foot rule? I know that a lot of teams, a lot of athletes are getting itchy. You got pro wrestling, which is, about to start, German professional soccer, Bundesliga. Major League Baseball talking about resuming maybe in Arizona with no fans.
Yeah, that's a big one, Walt, honestly, because when you think about how are you going to be able to really keep two athletes who are competing against one another from potentially infecting each other if they are carriers of the virus, if they're currently fighting off COVID-19. That's really challenging, and depending upon the sport, it may be more or less challenging to actually make that work. I can almost feel the public health officers around the country getting nervous just thinking about this, because everybody wants to go back to their normal activities. Some activities are much more challenging to prevent contact, like basketball, for example. There's just very close contact with athletes. You mentioned pro wrestling. I think that would be a challenge. Yeah. You'd really need to know if two people are going to be competing in close proximity, whether those people had the infection. So if they were both tested that day or something, then maybe you could figure something out. But just sort of carte blanche saying we're going to let people practice and get out there right now, I think would be ill-advised.
Yeah.
I could envision some precautions for certain sports. If somebody's 20 feet away from another person, they're kicking a soccer ball back and forth, that might be all right. But how do you regulate all that? How do you make sure people are safe?
Yeah, baseball, golf, tennis sound like it's somewhat doable. Wrestling, basketball, football, not so much. All right.